Okay, and our final speaker this afternoon, we've got Dr. Deborah Holder from Children's Hospital in Los Angeles.
So VNS is an implantable device used to treat epilepsy. So I'm an epilepsy doctor, as you heard, up at Children's. I treat children, but I'm going to refer to people as kids because I'm a pediatrician at heart. So what I'm saying applies to adults too. So adults are just big kids in my world. So I'm going to say kids, but don't mean that can't apply to adults. Again, I just think of everybody as a kid. So if you have seizures or someone you know has seizures and haven't responded to the first two medications, as you probably have heard, or if you haven't heard, it's something you need to know, the likelihood a third medication will work is less than 10%, probably closer to 4%. So anybody who hasn't responded to medication falls in the category we call drug resistant, and drugs aren't going to work for you. So you need to find another option. And we have lots of options that are available. We have epilepsy surgery, which is a good option. We have 3 different types now of what we call neuromodulation, of which VNS is one. So we're going to talk a little bit about VNS. So this is an implantable device. It's like a pacemaker for the brain. It's a little computer that sits under the soft tissue in the chest, and wires wrap around a nerve in the neck called the vagus nerve. So this device is not implanted in the brain. It's outside the brain, and we access the brain remotely by stimulating this nerve in the neck called the vagus nerve. So you can think of the device as turning on and off all day long, stimulates the nerve, sends a signal to the brain, changes the way the brain works, and seizures get better. All right? So it works in 3 different ways. So okay, let me just leave it on, and let me just show you the picture first. Okay, so there we have the wires wrapped around the nerve and the generator sitting in the chest. So you can think of the VNS as working in 3 different ways. We have the first way that it works is through preventative treatment. So it prevents seizures by stimulating that nerve, and kind of like you take medication every day, this is a standard mode or preventative delivery. It turns on and off all day long, stimulates the nerve, and prevents seizures. So just like when you take seizure medication every day to prevent seizures. So by stimulating that nerve, it does something to the brain which is not well understood, although there's lots of theories, and prevents seizures. You don't have to do anything. It does that all on its own. Then you have a magnet that you can carry with you, and if you feel your seizures coming on, or if you have a child with seizures, you see the seizure start, you can swipe the magnet. Device is in the chest, so you swipe the magnet over the device, it can turn the device on, and that can in some patients shorten or abort a seizure. So that's a preventative mode. So you can swipe the magnet and prevent the seizure from being prolonged, or sometimes you can prevent a cluster of seizures. Some patients with epilepsy tend to cluster back to back. So that's second feature. And about 2 years ago, they came out with a new device that had a closed loop system. So we have a lot of patients, especially children, who didn't have the ability to swipe their own magnet. So some of our disabled kids, or patients who have seizures during the night, or patients with no warning. They may just go right into a seizure, have no ability to swipe their magnet themselves. Even patients who don't have any disabilities and may be able to swipe a magnet, but their seizures come on so quickly they're not able to actually swipe the magnet when the seizure starts. So those patients really didn't benefit from a magnet unless they had someone with them at all times who could swipe the magnet for them. So that feature really wasn't very useful for our patients. So we worked with the company to come up with a way that we could find another way for that feature to be used without the patients having to swipe the magnet themselves. So this is an auto response system, and what we used was a heart rate. So as many people may know, about 82% of patients with seizures, the heart rate increases very rapidly at the onset of a seizure. And for those of us who spend our life reading the EEGs that you just heard were recorded in all these difficult places, when you're watching a seizure on video, the first thing you hear is the heart rate monitor go off in most every patient. So we can use that as a marker for a seizure. So the device now, it happens to sit right there next to the heart, so this turned out to be very handy. The device can monitor the heart all day long, and it sits there monitoring the heart rate all day long, and when it sees a spike in the heart rate, a very unique spike in the heart rate, a very rapid rise that's the marker of a seizure, it turns itself on and aborts that seizure. So now you don't have to swipe the magnet anymore. So this is what we call auto-stimulation. So this is a third feature. So you have that on and off all day long to prevent seizures. You still have the ability to use the magnet. So if you're a patient who feels your seizures coming on, or you're a parent with a child and you see the seizure start, you can still swipe the magnet. But now we have this auto-stimulation, what they call here detect and respond, where the device senses the heart rate, sees the heart rate go up rapidly, and it turns itself on to abort the seizure. And what we found in patients who had traditional VNS without that auto-stimulation feature, because VNS has been available since the 90s, who have now been switched over to this new device that has the auto-stimulation, their seizure reduction has actually even gotten better. So patients responded better to the new device than they did to the old device. So having the ability to have this auto-stimulation feature makes this device work even better than it did in patients who had the traditional VNS. So the nice thing about this device is it can actually work for anybody with an epilepsy. Doesn't matter what type of seizures you have, what causes your seizure, what your underlying diagnosis is. So anybody with intractable seizures that haven't responded to medication can respond or has the potential to respond to VNS. It does require surgery, so that's kind of the downside, although it's a fairly short outpatient surgery. It takes about an hour for a surgeon to place it. It can be placed by a neurosurgeon or a head and neck surgeon or an ENT, anybody familiar with the anatomy in the head and neck. And the side effects are actually quite low. I think there's a slide here on side effects. So the main side effects are related to this nerve, the nerve in the neck. So the vagus nerve also goes to the vocal cords. So sometimes you can get a change in the quality of the voice. Usually I describe it as more of a vibratory quality. Now this only occurs when the device is on. Typically the device is on for 30 seconds and then off for 5 minutes. So you're going to have this little change in the quality of the voice during that 30-second on time, and most of the time these side effects go away within the first year. So every month those side effects get less and less, and we've gotten pretty good at adjusting the settings of the VNS, so most patients really don't experience any side effects at all. You can always, when you have surgery, there's a risk of bleeding and infection. Those are really low. We haven't had really any problems with bleeding and infection in our center. So if you go to a surgeon who puts in a lot of these devices, you really shouldn't have problems with the surgical complications. Actually, this isn't the slide on side effects, is it? Maybe it's not in here. Well, those are the side effects. Those are the positive effects.
It's like 5 more.
There we go. It's a little slide. Hoarseness, that's what I said. Thank you. So sometimes you can have shortness of breath. That's more common in adults than children and usually goes away over time. The sore throat and the cough is also related to that vagus nerve. So a little bit of sore throat or cough. Usually you get the cough right after we turn the settings off. So when we first implant the device, we start very low settings, just like you start a low dose of medication. Then we go up usually every 2 weeks. And every time we increase the dose, you can get a little bit of irritation of that nerve that goes to the vocal cords, and you can get a little bit of cough or shortness of breath or hoarseness. Those go away over time. Usually within about 6 months, the patients don't complain of anything, and usually what I get is a frantic call from my patients saying the device stopped working, I don't feel it anymore. And then they come in and we check it and we say, no, it's still working, your brain just stopped telling you we're feeling it because your brain's really smart about things like that. So the side effects are really quite minimal, and again, only occur during that on time. So we have the device implanted by surgery, works in 3 ways, on and off to prevent seizures, magnet to abort seizures, and then this new auto-stim feature. So the auto-stim feature is really useful, especially for patients that have nighttime seizures where they're not awake and can't swipe their magnet, and for patients that can't use their magnet themselves. The brand new device that came out in the last few months also has an added feature in that we can program it for different settings based on time of the day. So this is really allowing us to do some fascinating things with VNS. You can set certain programs based on nighttime versus daytime. So if patients have more seizures one time or another, you can turn the settings and adjust them to specifically program it exactly for that patient's seizures. So this allows us more flexibility using VNS than we've ever had before. Traditional VNS only allowed us to program it for one setting, and that's all you got. And it had to be set on those settings 24/7. With the new device, we now have the option to set different settings for day and night. And then to address the information that we heard from the Danny Didd Foundation, we're working toward getting VNS to be a detection for potentially to prevent something like SUDEP, and that we now have a low heart rate detection and a prone position detection. So someday this may enable us to use this device to detect something like SUDEP. We're not quite there yet, but we do have a low heart rate detection that you can set the device to program that will detect when there has been a low heart rate. It doesn't yet alarm, but it detects it, so when the patient's seen in the doctor's office, we can look at that information and we can tell our patients if they're having episodes where the heart rate is coming very low. And we can then warn our families about that and see if we need to make adjustments on treatment or something that we need to keep an eye on. It also alerts us if the patient's been put in a prone position, which is face down. We think that this is a risk for SUDEP, that this may be a negative impact that may cause some patients to be at higher risk for SUDEP than other patients. So when the patients come back in clinic, if you turn those features on, you can look at that information that's been collected since the last time you saw your patient, and you can advise your families. And this gives us kind of warning signs that we can look for. There's other warning signs that we know about risk for SUDEP, and these are more warning signs that we can monitor with our patients. And maybe with the next version of VNS, these will then be alerting if we've not collected enough data that we can see that this device is accurately monitoring those features. So we can use this data now to give warnings to our patients, but also collect data to help us make the device better for the next generation. So I think that's kind of exciting information about the VNS to come, hopefully in the next couple of years. So I think this is really a helpful device for patients who have failed medication and still are having frequent seizures. It can be used, it's now approved for kids as young as 4, so we can use it in children all the way up into adulthood. and it's something that is really beneficial for our patients who haven't been successful with medication. I got another talk to do.
So we'll have just a time for a few questions. We've got one in the front.
I was going to ask EEG, what's the longest period of time you can do like an at-home EEG?
It's really up to the physician that's ordering the test, frankly. But we have clients who go many, many days. They can go a very long time. Usually that will, if you go beyond 72 hours, really it's recommended the subject be reapplied, check the electrodes, and change batteries, things of that nature. But we've seen studies go 14 days or longer, but usually with some attention during that time period.
We do 72 hours in our facility, and then we really reset the electrodes after that time. You can safely leave those electrodes on the head for about 7 days without taking them off and reapplying them. We do 14 days inpatient without having to reapply.
Any other questions for any of the panelists? Go ahead.
So the detect and respond VNS, does it, what would the model of that one be called?
So that's called Sentiva.
And does it also have a magnet as well?
It's got the magnet. So we like to say magnet's queen. Some people say magnet's king, but I say magnet's queen. So the magnet always wins. So if you're not sure if the auto-stim, we call it auto-stim, that automatic sensing device. If you're not sure if the auto-stim turned on, if you swipe the magnet, it still turns on. And if auto-stim had turned on, it stops auto-stim and magnet still fires. So until we get the settings right and we're sure auto-stim's picking up your seizures, we still tell the families to swipe the magnet just to be sure. And then once we get the settings perfect, and we have ways in clinic we can test the device to make sure that the computer timestamps the auto-stims and it timestamps the magnet swipes. So when you come back to clinic, we can check and see if auto-stim caught your seizure, and then we can tell you it's catching your seizures, you don't need to keep swiping the magnet. But you can still, magnet always wins. It's in charge. It's a pretty cool device, I think.
How long do the batteries last?
So 4 to 6 years, depending on the settings. So actually, it's kind of interesting. So we always think we want something to have the longest battery life until something new and better comes out. So the last one that came out that had an auto-stim feature, they said 4 to 6 years, but now this one comes out, and the Sentiva has this day-night programming, which is totally cool. So I can do all these really fancy things with day-night programming, and the last one didn't have that, and now I'm wishing those batteries would die. So so I'm like, oh, they made that one 6 years ago. They actually didn't last 6 years, and now I want the new one, and I can't put it in. So then I have to be like creative and tell the insurance company the battery's dying because maybe I can get it. So, but it's really interesting that we've done some data looking at our patients with what we call traditional. I don't know what people in the world call it. I call it traditional VNS, kind of the old VNS without the auto-stim feature. And patients who transition from old VNS to new VNS, the traditional VNS seizure reduction is about 62 to 65%. Just everybody lumped together. I can tell you which seizure types respond better or worse, but if you lump them all together, about 62 to 65%. With the new VNS, that's up to 75%. And there was just a study published out of England that confirmed that, and our data at CHLA is showing that as well. And we've put in a lot of the Sentivas. So, so the new device seems to work even better than the old one did. So something about that auto-stim, whether it's catching seizures faster and that's overall improving seizure reduction, that they may be catching seizures so fast that the patients don't know they're having it. Because you probably know this from EEG, sometimes you'll see the heart rate go up before there's even a clinical seizure. So it may be catching the seizure before the patient even knows that they have a seizure. So in essence, their seizure counts go down because they don't even know they have that seizure because it stops it before they have any clinical signs, which is really interesting.
And does it, I've heard that sometimes it can also help with like anxiety and depression.
It can, good question. So I didn't get to that because I didn't want to go over the time because we have a limit here. So it's used for depression in adults. So there's actually been formal studies that it got an FDA approval for depression. So it definitely treats depression in adults. We see these what we call positive side effects, which was the slide I had up when I was talking about the real side effects. My bad. So we see patients tend to be more alert. In kids, we see they do better in school, they have better learning skills. In adults, they tend to have improved memory and improved cognition. And then almost everybody has a faster recovery procedure. So patients tend to recover more quickly. If patients had slept for 3 to 4 hours, they tend to only need 20 to 30 minutes. So when you look at the whole day, there's patients who are down for 2 days after a seizure. And if it wasn't bad enough that you had a seizure, then you lost 2 days recovering from your seizure. So one seizure takes out 3 days, which total stays. So if you can recover in 20 minutes instead of 2 days, that's kind of a win-win. So we see that improved post-ictal time in almost everybody. And those improvements come before the seizure control. So it's not just we made your seizures better and took you off meds that you're brighter and more alert and do better at school and your job and everything. It's actually something different the VNS is doing, which we don't completely understand exactly what it does.
We had another question here.
Yeah.
So I've been competing in sports for a long time, but I just stopped moving because I have epilepsy. So
Yeah.
can I still be anything physical with the VNS?
Yeah, we don't restrict with that physical activity. I mean, I don't think anybody with a brain should play football. That's just my own personal opinion. But we don't restrict sports with VNS. No, I have a kid who plays hockey with VNS.
But it won't rip out.
No, it doesn't rip out. It's sewn in. It's completely inside. Yeah, they put those wire around and they tether it in place, and it's sewn into place. It doesn't move. It doesn't come out.
I feel like wrestling.
No, it shouldn't be a problem. I mean, it depends. I mean, every surgeon's different. In my institution, we don't restrict sports with it in. Yeah, I mean, I can't speak for every surgeon. Only mine.
Any other questions before we wrap up?
They sew it in there pretty good. It's inside.
What type of surgeon implants?
So we use a neurosurgeon, but it can be anybody who knows head and neck anatomy. So some centers use ENT, some use head and neck surgeons. So the vagus nerve is pretty easy to find. It's in the carotid sheath with the carotid vessels. You just open the vessels and the nerve is pretty easy to identify if you're familiar with that area. It's a pretty short surgery. It takes about 20 minutes to put it in.
And then how do you change the batteries?
So once the wires are in, they never come out. So the wires are good forever. The wires are actually pretty well made, and we've not had a broken wire, gosh, knock on wood. I think my last broken wire was 2005, so it's been a really long time. So the wires are really well made and don't need to come out again. When the generator dies, they take the whole one out and get a brand new one. So yeah, you're good. And they just unplug the wires, take the generator out, put it back in. So a small incision, that's like 10 minutes to replace the generator.
Ma'am, go ahead. Question in the front.
Yeah. If you're, you know how now there's metal detectors everywhere, that would be something that you.
It doesn't go off. Yeah, titanium. It doesn't set off the metal detector.
So it doesn't sit up?
No.
You can literally
Go walk right through. Yeah, we give you a little card when you get it that says you have an implantable device, like any company would. And we just usually tell people to describe it like a pacemaker for epilepsy, because most people have an idea what a pacemaker is.
Right.
But it doesn't set off the metal detectors at the airport. No, completely safe to use. Yep, you can just go live your life and not worry about it.
Okay, one last question here.
Does it affect if you're going to have a test like an MRI?
It does. So good question. So because it's operated by a magnet, that was very good that you thought of that. So it can be turned off before you get an MRI. There are some MRIs that you can't do. MRI of a certain area of the cervical spine is you can't do with it in because the wires can heat up. But MRIs of the brain can be done, and MRIs of the joints can be done. So CT scans and other scans are okay. So it's something that you want to talk with your doctor about. We feel like we need to stop seizures. And if some point down in the future a patient gets an MRI of that area, I'd rather take it out at that point because I can image the body in other ways. But you can get an MRI of the brain, which is most important to us as neurologists.
So I just remind you that everybody here on the panel has a table, so feel free to go visit with them. There are other device manufacturers here as well. Empatica has a table, Smart Monitor has a table, and there may be more. So please ask questions at the tables. Thank you for being here, and let us know if we can be helpful or put you in touch with the people you want to talk to. Thanks.